older individuals living with serious illnesses often find themselves in an unending cycle of back and forth visits to the hospital, doctors, and rehab facilities. As you can imagine, this can be very difficult for those who require extra assistance. That's where Gilchrist Elder Care Program steps in, designed to take away that burden, ensuring that people receive the care they need when and where they need it. Nurse practitioner Beverly Ruiz took us to the home of patient Darlene to get a first-hand look at the impact this program is having. I'm interested in knowing what your condition is and how you got there. What happened to you?
Back in February 9th, 2017, I had some symptoms that I didn't know was a stroke. I was trying to make steps, and my left foot, I could not figure out how to walk with this leg and that foot. So about 12 hours later, I could not stand up on it any longer. It just wouldn't hold me. So they admitted me, and they did the MRI, and when they did that, they found out that I did have a stroke. So fortunately, and like I said, when I got Beverly and Gilchrist, everything for this stroke and what I have to go through with it has absolutely changed.
So besides the paperwork, is she actually your physician?
She's my primary care physician, yes.
She takes your blood pressure and...
She does everything.
Can you imagine what life would be like without Gilchrist?
I don't know. I don't know where I would be today if it was not for Gilchrist and Beverly and what they have done for me. I know there's so many other things, but like I said, without them, I do not know where I would be. I don't know what we would have done. Anytime you call there, like I said, they're just there to help you, to get you the help you need. They never make you feel bad or like you're a pain or a bother to them. They're a great company. I mean, if that's the word that you use for Gilchrist, I don't know what the word should be, but they're absolutely, I can't say enough. I don't know where I would be. If it ever comes time that you need to have services.
You sold me.
Because there's never not enough that Beverly and Gilchrist and all those ladies and all those different companies that they send here, they can't do enough for you, any of them.
We set out on the road with nurse practitioner Beverly Ruiz to learn more. What inspired you to do, this kind of work?
When I was a nurse working on my master's for my nurse practitioner program, I worked in home health. And so it gave me the opportunity to see what it's like when someone comes home from the hospital or leaves the doctor's office with a bunch of instructions and no idea what to do with it. Suddenly it's different. It's much different when you're in a home environment. And so 5 years ago, there was a shift in the medical arena where we were seeing more patients that really couldn't get out to the doctor's offices. And that's when the geriatric practice at GBMC really recognized the need that we had to have something to bring care to the home.
And when you get a new patient, or you have an established patient, I guess, what's the main thing you try to do when you visit?
So when we have a visit, we review the medications. We address whatever the need is at that time. Is there a new symptom? Is there a concern? Is there something that we have to evaluate further? Is there a need for additional services? Is there anything that we can do that would make the patient more comfortable in the home? We like to make sure too with every first visit with our patients is what are their goals of care? What is it that they are looking for? Is it their desire to remain in their home at all costs, or do they still want to have aggressive medical treatment? And what can we do to try to help them reach their goals of care?
And Darlene seemed to refer to you as a friend or a member of the family. That must happen a lot.
You tend to get, we follow patients for the most part for at least 6 months. Sometimes it's a few years that you'll get to know somebody. It just depends on where they are when we meet and what their needs are. and you do tend to feel like you're part of the family.
Is there anything I haven't asked you that you wanted to bring up?
You know, I think that the thing that's important about this program is that we're serving a population that has a difficult time getting out. That if you can't get into the doctor's office for your medications, or you can't get in for routine symptoms that might, become a bigger problem, then people end up using the emergency room for their care. And that this program, by being able to bring all of these resources in the home, has cut down on our hospitalizations and emergency room visits and allows us to provide care to people who need it the most in their home. And that's really where they want to be.
Gilchrist Elder Care provides the resources and support you and your family need to maintain the best quality of life. From comprehensive health assessments and medication and symptom management to the little things like light meal preparation, assistance with errands, and companionship. For greater living, I'm Don Scott.